We are live. Okay.
Okay, hi everybody. My name is David Hardgrove and I'm with PA MEDI. PA MEDI is a SHIP in Pennsylvania and State Health Insurance Assistance Program. We are certified counselors. Everybody should be familiar with this book. And it's put out by the U.S. Department of Health and Human Services. And on the back it says, if you have any questions, call PA MEDI. So that's who we are. We're not brokers, we're not selling you anything. We're here basically to help you with your Medicare needs. So, given that, I already mentioned we're part of the State Health Insurance Assistance Program. And in Pennsylvania, we're under the auspices of the Chester County Department of Aging. As I said, we don't sell anything. We are volunteer counselors. We are certified. And the certification process is pretty lengthy. I'm not going to go through it all. We have no interest or financial interest in any decisions you make. Our job is to tell you what your options are. Okay? We do telephone counseling. We do these presentations. We do one-on-one counseling at various sites. And we are really problem-solving and troubleshooting. Okay? This roadmap you're going to see a few times in all of our presentations. And the one thing that it highlights more than anything else is original Medicare, which is a law. The law was passed in 1965 and signed by Lyndon Johnson. And it covers certain things that we're going to talk about. The things that it does not completely cover are picked up by Medigap or supplements. And there's also a separate prescription drug benefit. Many people choose this path, and many people choose the path of Medicare Advantage plans. You must still have original Medicare, okay, which means Part A and Part B. This is the privatization of Medicare. There are private insurance companies approved by Medicare. There are monthly premiums possible. There are also premium-free Medicare Advantage plans. Okay? There are co-pays. And basically, every Medicare Advantage plan, okay, you have to be in a network of doctors, specialists, and even the hospital has to be in your plan's network. Probably the most famous case in Chester County is that Humana Medicare Advantage plans are not do not have a contract with Chester County Hospital. Okay, so if Humana, their supplements do, okay, but their Medicare Advantages don't. That created a problem a few years ago with Brandywine Hospital when they shut down. There were many people out there that had Humana Medicare Advantage plans. Okay, when it shut down, where did they go? Chester County Hospital couldn't take them. Fortunately for us at that time, there were some 5-star Medicare Advantage plans, and we were able to put them into those. Okay, so what are the Medicare costs in 2024? Okay, Part A, there is no premium if you've worked 5 or 10 quarters, or 40 quarters, or 10 years. Okay, so if you've worked 10 years, it doesn't have to be consecutively, just by quarter, you would be eligible for premium-free Medicare Part A. Okay, if you haven't worked, there is a premium for that. Most people get premium-free Part A. There is a $1,632 deductible if you do not have a supplement and you go into the hospital. Okay? Part A is hospital insurance. Covers basically hospital and hospice. Part B is medical insurance. That's when you go see your doctor, you go get an x-ray, you go get an MRI, you get a colonoscopy. It basically covers all doctor's visits, specialist visits, and non-admitted or outpatient procedures. Okay? There's a premium for that. And whether you have a Medicare, original Medicare, or an Advantage plan, you pay that premium. In 2024, that premium is $174.70. okay? There's also an annual deductible for $240 with Part B. So the first $240 in the entire year, okay, is you get a $240 deductible, okay? Part C is the Medicare Advantage plan, and the premiums vary by plan. Many of the plans have a $0 premium, okay? And the deductibles and copays vary by plan. And it varies by zip code. It varies by county. All right? So for example, in Chester County, medical costs are pretty high. And many of the plans, if you go into a hospital, there's about a $275, $290 per diem in the hospital, okay, for the first 6 days. Okay, I'm giving an example here, not exact numbers. All right? However, if you were to live in Punxsutawney, and I can quote this because I just talked to a guy there, a hospital stay is $250, period. Okay, so it's not per diem. Okay. So the deductibles and copays vary by plan. Okay, so some of them are premium free to see your primary care physician. Some of it could be $5, some could be $10. We're going to talk about Medicare Part C a little bit more. Okay, and Part D is prescription drug plans. Prior to 2006, I believe, there was no prescription drug coverage with Medicare. All right, and the premiums vary by plan. And it's what they call a formulary, which is the list of drugs that a particular plan covers. All right, and every plan has a different formulary. And the cheapest plan this year is 50 cents a month for the premium. Okay, the most expensive one is probably well over $100. Okay, these plans change every year. So because you're in a good one for your drugs this year, it doesn't mean you'll be in a good one next year. So we encourage people to come talk to us every year if they have a Medicare Advantage plan or a drug plan. If you have a Medicare, original Medicare with a supplement, okay, a supplement's like a marriage. Okay, you sign up for one, and you end up with that pretty much for life. Now, can you get a divorce? Yes. You have to go through medical underwriting. I've done it twice. Okay, as a prostate cancer survivor from last year, I couldn't do it now. Okay, because they look at pre-existing conditions. Medicare Advantage plans do not look at pre-existing conditions. You can change them every year. They're one-year contracts. You cannot have a drug plan, okay, and a Medicare Advantage plan. Okay, because the Medicare Advantage plans have drug plans for the most part embedded in them.
David, did you want to mention if people have questions along the way?
Yeah, I'm gonna do that, okay? He's gonna let me know when there's people in the
Yeah,
chat.
folks on Zoom can type in the chat, and people in the room, feel free to ask along the
Okay.
way.
So what do all these TV ads mean? And mailings, by the way. Okay. How many people saw Joe Namath on TV last year? Okay, touting Medicare Advantage plans. Well, he created a lot of confusion. Did you notice he didn't talk about the medical benefits of the plans at all? He only talked about hearing, dental, and vision. Okay? Get all the Medicare you deserve. Well, what you need is medical. Right? So, CMS, the Centers for Medicare and Medicaid Services, who approve all of the drug plans and all the Medicare Advantage plans, have issued a regulation now that TV ads have to be approved now, as well as all advertising. By the way, if you get calls from people saying, would you like to talk to someone, the minute you say yes, okay, they can call you every day, day and night. You know, the minute you send in for a brochure, you've basically given them permission, okay, to contact you. Okay, we're going to talk about Medicare Advantage Plan, the additional benefits. I bring this up because they talk about dental, vision, and hearing, you have to stay in the provider's network. You cannot go to any dentist you want, okay? You cannot go to any audiologist that you want. They have to be in network. The average annual maximum for dental ranges from about $500 to about $3,000, okay? You have to make sure what procedures they cover. Many of them do not cover implants, but they will cover crowns and things like that. It's also a question, is it dollar for dollar? For every dollar you pay, they pay, okay? So you have to kind of look into the details of these plans. All right? The maximum out of pocket, that's regulated by the government. $8,850 for a Medicare Advantage plan. Once you pay $8,850 in network, not out of network, okay? You're then, the rest of it is paid for by your plan, okay? One of the things I want to talk about here that's not on this slide are authorizations. We have a case where Pam's sister was in a hospital stay, and she was bedridden, home. She's a single woman. And she qualified for meals after her hospital stay for 10 days, 2 meals a day. Well, they weren't given the authorization for 2 weeks, so what good did it do her? So if you talk to your physician, your family doctor, you might want to ask, if you're thinking of Medicare Advantage, which plans do they take and which plans do they have the most problems with in terms of authorizations? Because you'll need an authorization for a colonoscopy, you know, just generally speaking, everything you want to do. Okay? So these are some of the benefits. Allowance for over-the-counter medications, they can vary from $50 to upward of $150. It's usually use it or lose it. They'll give you a month to use it. So you can buy toothpaste with it, anything that they sell in the pharmacy department. Mouthwash, toothbrush.
Band-Aids.
What's that?
Band-Aids.
Band-Aids, anything you want to get. So when can you change your Medicare? Is there any questions about Medicare Advantage plans before I move on? The key thing about them is you have to stay in network for everything. Now, some plans in Medicare Advantage are PPOs, which you can go out of network, okay? And you're gonna pay a higher copay. It could be 30–40% of the bill you have to pay. The problem is people think they go to any doctor. You can't. The doctor has to accept assignment or what the Medicare Advantage would pay.
It's a question from chat. Where to go? What is the Part B reimbursement?
Part B reimbursement is, how do I explain this? For certain low-income people and in certain plans, they will pay part of your Part B premium, that $174.50. Okay, it's part of the Medicare Advantage plan. Sometimes there's an income limit on that, sometimes there's not. It depends on the plan. You have to look at each one of these plans independently. I will say this, there are, I believe, 10 companies that offer plans in Chester County. For example, Keystone, which is Blue Cross Blue Shield, they offer 5 Medicare Advantage plans, HMOs, and 2 PPOs. So Aetna offers 5 or 6 plans, so it's not, UPMC, I believe, offers 2 plans. So they have a number of suppliers or providers, okay? They offer several plans, so you might have a choice of 30 plans, and most of those plans, by the way, are 0 premium, okay? It's pay as you go. Those plans are extremely profitable to the insurance companies, okay? They are extraordinarily profitable, and that's one of the things that CMS is looking into.
As for United Healthcare, are they taking a model into Chester County, Montgomery?
Yeah,
County?
United Healthcare is here.
Okay.
They offer a couple plans, yeah.
All right.
I don't have the list of all the people right at the top of my
Right,
head.
right.
Okay, UPMC, you know, there's one plan that's very popular here in Phoenixville because PMA takes them. And I don't know if you're familiar with PMA, they have like soup to nuts, they have family docs all the way up to oncologists, and they, same practice, I think they have 70 or 80 doctors. And they take some Medicare Advantage plans. Not every doctor takes all Medicare Advantage plans. You have to be careful with that.
And they can change from year to year.
And they can change from year to year.
They can drop out.
By the way, your doctor can quit the plan anytime. You can't. Once you sign up for it for the following year, you gotta stay with it. Okay, question back there.
The maximum out-of-pocket for the Medicare Advantage, $88.50, is that for all circumstances, for even, let's say for a kidney transplant or other serious surgery?
Yes.
Et cetera?
Yeah.
Is that the
In
maximum
network.
that you would have to pay even under such dire circumstances?
Right, in network. Okay?
Right.
Now, I just went through 45 radiation treatments and hormonal therapy treatment, okay, with a supplement. My total bill was $0. Okay? You know, it's sort of like they sell you on one thing, but you have to look at everything in thing. And I had 2 minor surgeries, so,
When you say a supplement, do you mean Medicare?
yes. Okay? We're gonna talk about that a little bit. One of the reasons we talk about Medicare Advantage first is because there's a lot of misinformation out there about Medicare Advantage plans. And people are inundated with them, and CMS is trying to reform them, okay? They've to be a little more honest. Hate to use that word. Okay, so when can you change your Medicare plans? You have a Medicare plan, okay? Everybody has Part A and Part B. Okay. There's multiple open enrollment periods. A lot of people confuse them all, okay? The biggest one is from October 15th to December 7th, okay? If you have a Medicare Advantage plan, you can change that plan during that period of time. Okay, if you have a standalone drug plan, with or without a supplement, you can change that during that period of time. You cannot have a Medicare Advantage plan with an embedded drug plan and a separate drug plan. Okay? As a matter of fact, you cannot, by law, have a Medicare Advantage plan and a Medicare supplement. Okay? So you want to review those plans every year because the premiums change, the drugs they cover change, okay, the cost of the drugs that they cover changes. That catches a lot of people. I can't tell you how many times in January I get phone calls and the people say, geez, I was paying $3 for drug XYZ last year and that was $32. Okay? Well, your plan changed. And you will get every year in September by law a notice called ANOC, Annual Notice of Change, and it must tell you every change in your plan. They make great bedtime reading. You could fall asleep with that thing in 30 seconds or less. Okay? But what you can do during that open enrollment period is you can change your drug plan, you can change your Medicare Advantage plan, and you can do it as many times as you want. My first year doing this, and I've been doing this for 7 years now, I had a guy come in at least 10 times over the last 2 weeks of Medicare open enrollment. He changed his Advantage plan every day. Okay, every day. It's the last one that goes in the system that counts. Same with the drug plans. Don't know why, but that's what happened. Okay? When you change your Advantage plan, it continues on the one you have for the rest of the year, and everything changes January 1st. That's why I say I get a lot of phone calls on January 1st. Why are my drugs so expensive? Okay? We do a lot of help with people during open enrollment, but the key thing there is you want to change your Medicare Advantage plan. And you have a primary care physician, you have a cardiologist, maybe a urologist, I can't even think. The plan you're going to, those doctors have to be in that new plan. Okay? And my advice to people is to call each individual doctor. Don't talk to the receptionist, talk to somebody who does the billing and give her the plan number, okay, which you will get, and see if it's covered. Or they're covered, they're using that plan, okay? You also have to look at the drugs in that plan, okay, because every Medicare Advantage plan has a different formulary or list of drugs they cover. Okay. There's also an enrollment period that very few people know about. During the first quarter of the year, let's say that you enrolled in a Medicare Advantage plan, you find that your doctor doesn't take it. Well, you get a one-time switch to a new plan during January, February, March of the following year. Okay? And coverage will start the first of the month after you make the switch. Okay? You can also, during that period of time, switch from a Medicare Advantage plan to original Medicare. You do not need a supplement. There are many people out there who do not have a supplement with original Medicare. Okay? They do get a drug plan, but it's not uncommon. If you switch to a original Medicare and you do want a supplement, and you're out of your special enrollment or initial enrollment period, okay, you may be subject to medical underwriting to buy a supplement. In other words, they will look at pre-existing conditions. I had a heart attack in 2014. They only care if you had a heart attack the previous 3 years. Didn't matter. I was able to switch. Okay?
Question from chat. How easy, difficult is it to change your Part D plan every year? And does the insurance plan underwrite you?
Okay, it's very easy to change your, the question was, how difficult is it to change your Part D plan? It's very easy. Actually, on Medicare.gov, there's what they call a plan finder. And oftentimes after we help somebody for 2 years or so, they figure out how to do it themselves. They go on and they check their drugs against the thing, and they can change their drug plan very easily. There is no medical underwriting changing your drug plan or an Advantage plan. There's no pre-existing conditions. You can change those every year, no problem. Okay, but you have to do it during open enrollment. The drug plan has to be done during open enrollment. The Medicare Advantage plan can be done during open enrollment or this one-time loophole. Okay? So, any changes will be made the first of the month following. During the AOEP, the one from December 5th to October 15th to December 7th, those dates don't change every year. They're exactly the same dates every year. Okay, they take effect January 1st. A change here takes effect the first of the month following the change. Okay, you can only change once. You get one shot at it.
You mentioned a loophole. Could you repeat that again, please?
Well, the loophole, basically, I call this a loophole. This was just introduced a couple of years ago. Up to then, if you changed your Medicare Advantage plan and you didn't like it, or your doctor didn't take it,
Or if something cropped up in your medical situation? Okay.
you were stuck with it. But now you get a chance. I call this the loophole. It's really not a loophole, but you can now change your Medicare Advantage plan one time in the first quarter of the year. So if you did make a mistake during the first enrollment period, you get another one. Okay? Other times you can switch plans. I want to talk about the third one. It's not on here. If you never signed up for Part B, and you didn't do it when you're 65, okay, and you decide you want to now get Part B, you can sign up during the first quarter of every year. Okay? You sign up, let's say you sign up in January. You would then be able to, your coverage would start with Part B on February 1st. There is a caveat though. For every 12 months you did not have Part B after you were eligible, okay, you pay a 10% penalty of the Part B premium for the rest of your life. So that $174.50, it's $17.45 if you didn't get it the first time.
They do something that to your drugs too, don't they?
Yeah, the penalty is much less onerous though. If you don't sign up for your drug plan when you're supposed to, there's a penalty of there's a calculation, but it basically comes out to about $4 a year, $4.25 a year. I did have an issue with someone one time. They never signed up for a drug plan for 10 years, and of course that became a bigger number. It became like $45 a month that went on to the drug plan. Understanding you could buy a drug plan for as low as 50 cents, and a lot of them, the average person pays probably $30, $32 a month for a drug plan. But, you know, for most common drugs, you can get something for $10, $12, or even the 50 cent. That 50 cent a month one is new this year. Who knows if it'll be around next year?
That
Okay.
was something I was never told, I remember being told.
What's that?
You had to have a drug plan.
You don't have to have one. By the way, I want to mention something about drug plans. Many people have retirement coverage with a drug plan. People that retire from pharmaceutical companies often get pharmaceutical coverage for free for the rest of their life. But the big one is the VA. Okay, I have a friend who was diagnosed with stage 4 lung cancer. And he's on a drug that costs like $3,600 a month. Well, I said to him, you were on a nuclear submarine in 1970, right? Yeah. Asbestos. So he went down to the VA and he was approved like within a week. And that same drug, he's now paying $10.50 a month for. The VA is very good coverage. And a lot of people get all their drugs to the VA. And it's something to look into if you're a veteran that qualifies.
Another question from chat. What type of evidence do insurance companies request to enroll in Part D if you worked past age 65 and had creditable coverage?
There's a form that you fill out, okay?
Oh, he also says, is there a special form that the insurance company provides, or is it the CMS 564?
Yeah, the 564 is both for Part B and for D. Okay? If you work past 65, let's say you work till you're 70, you had creditable coverage for work. Okay, you get what they call a special enrollment period. It's probably the most common one. And you can sign up for B and D, okay, over a certain period of time after you get your Medicare Part B card. You need the card or you need the number, okay? Then you fill out a Form 40B, which is the application for Medicare Part B. And then there's a 564, which your employer signs off on, an L564, that your employer signs off on, that basically said that you've had creditable coverage. The forms are typical government. They have 6 pages of explanation and 5 lines to fill out.
Another question from the chat. What if you have benefits from work, then retire? I have Medicare Part A, but am retiring at the end of the year. Do I pay a premium on top of my Medicare B?
No. You have a special enrollment period, okay? And that special enrollment period allows you to sign up for Part B using those 2 forms, okay? The thing is, from the date of Part B effective date on that card triggers a lot of things, okay? You have 6 months then to sign up for a supplement, a Medicare Advantage plan. You have 63 days to sign up for a drug plan. So some people don't kind of forget about the drug plan, but
David, may I interject you?
what?
It's on this slide. What helps some people that maybe when they turned 65, they didn't know that they had to have a drug plan? The PACENET program.
Okay, there are a number of different plans to help low-income people pay for their drugs. One of them is called LIS, which is called Extra Help in the industry, and that's administered by Social Security. And you apply through it online, okay? If you get LIS, you automatically get your Part B premium paid for. okay? And there is an income limit and a asset limit for that, all right? PACE and PACENET is a state-run program, and I will say this, it's probably the best state-run program I've ever run across. You call them on the phone, and 5 days later, you know whether you're approved or not, and you can start using it right away. PACE and PACENET are creditable drug coverage. You don't need a drug plan with them, but you better have one, really, okay?
The question from the chat, can you repeat the name of the other form in addition to L564?
40B.
Thank you.
Okay? So the PACE and PACENET have income limits. PACENET in particular has a fairly high income limit. I forget the number, it's probably written down over here, but it's something like $41,000 a year for a couple. Okay? And the drug costs are highly reduced. In PACE, I think you'll never pay more than $10 or $10.50 for a drug. Okay? So it doesn't matter what it is. And the nice thing about it is, if the drug is not on the formulary, it oftentimes you call them up and they'll make a special exception for you. They're very easy people to deal with. Extra help, the one thing about PACE and PACENET is you can switch your drug plan or your Medicare Advantage plan once a year without penalty. Okay, it gives you a little bit of an enrollment thing. There are companion plans that work with PACE and PACENET. Okay? We can work with you on that, how to get the lowest cost of doing business, okay?
So it's also, just gonna interject here, because I didn't think this gentleman said he wasn't told about the drug penalty, but PACE and PACENET, if you were to be eligible and approved, they will waive that penalty for the drug premium.
Yeah, I forgot to mention that. Again, they do a one-year look back on your income. Okay? So, and you have to be 65. You cannot be 64 and so you could be on Medicare when you're, there was a case recently where a 7-year-old girl was put on Medicare. She was disabled permanently. After 24 months on Medicare and on disability, you're automatically put on Medicare the 25th month. She had a big problem. How many pediatricians do you think take Medicare? She couldn't find a doctor. Okay. So what are special enrollment periods for MAPD? Medicare Advantage prescription drug plans, okay? They combine the two. In other words, you get the medical and the drug all combined in one package. All right? There are special enrollment periods, as example, when you stop working, okay? There are special enrollment periods like that first quarter of the month, which I erroneously called the loophole before. If you move, I had a woman recently, she was on a drug that was an infusion, it was very expensive. She couldn't afford it, but she moved to Texas with her mother. Her plan was not in Texas, so she was given a special enrollment period to sign up for a supplement there. After the drugs were done, she moved back to Pennsylvania. Okay? Or if you lose insurance coverage, every once in a while, a company will decide we're no longer going to write business. That generally doesn't happen. As I said, a lot of these plans, particularly Medicare Advantage plans, are very profitable to the insurance companies. This doesn't happen very often. Okay? In fact, I've been doing this for 7 years, and people misunderstand the information they're giving, but they're not necessarily given misinformation. And the company pretty much has to admit that they gave you misinformation. So, I've never come across this as an actual something that happens. I'm sure it does happen. Okay, vaccines. One of the things that's changed for 2024 is that shingles vaccines, which I purchased a few years ago at a lot of money, and are now included. So basically, all vaccines are now included in for Medicare, period, whether you have an Advantage plan or a supplement.
Which means there's no copays.
There's no copays. You get the thing, you go to the, well, we did hear somebody getting hit with the bill. If you go to the drugstore and get it done, it doesn't cost, okay? But somebody went to
An urgent care
an
within a
urgent care
drugstore.
to get their vaccine, and it wasn't covered there. So you kind of got to be a little bit careful.
You have to go to the pharmacist department, not the urgent care department.
Okay, this is about transition fills. If you run into a situation where you change drug plans and you're running out of drugs, you can get transition fills, okay? This does not apply to new prescriptions that you got under the new plan. It requires getting, and that gives you, what does that give you? That gives you time to figure out how you're going to get that done for the rest of the year. Okay, how prescription drug plans work? We all have seen deductibles limited to $545 a year. Now, let's say you're on atorvastatin and lisinopril. All those drugs are pretty much free when you go to the drugstore. I mean, they're $1 for a lot of money. So, their drugs are tiered, tier 1 through 5, okay? If you see it on TV, it's expensive, okay? You know, all those people that are so happy with Xarelto and everything else like that on TV, okay, they didn't get the bill yet, all right? But for tier 1 and tier 2 drugs, which are generics, there's usually not a copay. Usually they don't bother with it. Otherwise, you wouldn't have insurance if that's all you're taking, okay? So usually when you get into tier 3 and 4, which are branded drugs, and 5, which are specialty drugs, you start paying against that deductible. All right? During the coverage benefit period, you're going to pay the percentage that's in the contract. There used to be what they call the donut hole. Okay? The donut hole was a period of time, up to about 5 years ago, this was in effect, is when your drugs cost a certain amount of money, all of a sudden the government stopped paying for them. You had to pay the full cost. And that was a big nut. They've reduced that to 25% of the cost of the drug now during the donut hole. This is the last year that will be in effect. Okay? The Inflation Reduction Act reduced your drug costs totally to $2,000 a year. In other words, your premiums plus what you pay at the drugstore cannot exceed $2,000. Doesn't matter what drug you're on. Okay? And then what they call catastrophic coverage used to pay 5% and it's basically zero now. Okay, once you hit a certain number that's been spent, the drugs are free. And really, basically, that triggers it. Okay? Starting in 2025, you cannot pay more than, it doesn't matter what drug you're on, you cannot pay more than $2,000. Now, I will tell you this, the drug companies are not very happy about this. Okay? Do I feel sorry for them? I worked in the pharmaceutical industry for 20 years. Okay. The Inflation Reduction Act, basically the first year was in effect, it reduced insulins to $35. Okay? That does not include diabetes drugs like Jardiance or whatever, okay, which are tablet form. Okay? 235 and 24, it eliminated, remember in that previous slide, eliminated the catastrophic coverage pay. In 2025, there's a cap on all Part D drugs. I want to mention here there are Part B as in boy drugs as well. Those are drugs that you receive at a doctor's office or at a medical facility. Not in a hospital admitted. Okay? Admitted, they're Part A drugs. Okay? If you're in a hospital though under observation, they're Part B drugs. Go figure. The, so the $2,000 cap is for Part D drugs only. Okay? So let's say that you're gonna be taking Remicade, which is infusion. Had a patient or a beneficiary about 2 years ago, and the Remicade was $7,200 per. Okay? For Medicare Advantage plan, all Medicare Advantage plans only cover 80% of that because it's a Part B drug. A supplement would cover 100% of that. Well, 20% of that, twice a month, 2 times, it's about $3,000. Her income was $3,000. She's the one that moved to Texas so she could buy a Medicare supplement. Okay? In 2026 is gonna be really when the government's gonna start negotiating with the drug companies, and they've already announced the 10 drugs that are gonna start that. Okay, there's a progression. More and more drugs every year are gonna be added to that. Okay, that they're going to have government set pricing on. Most of the drugs they're picking are obviously high Medicare users. Drugs that have been around for 10 years and are still costing a lot of money. Okay, I think Enrollment has been around forever. It's a rheumatoid arthritis drug, and I think that might be one of them. But don't quote me on that. Okay, so what are your options to pay for generic drugs? Or for, sometimes cash is cheaper. I just go to Costco and say, I need this drug. One of the things that comes up all the time is Viagra. Medicare does not cover drugs of, what do you call that, convenience or whatever. It has to be medically necessary. Now, how many people medically necessary need Viagra? If you go to buy it under your drug plan, it's going to cost you about $350 at the drugstore. But if you just go and say, I have GoodRx, and you just say, look it up on the computer, goodrx.com, it's about $10 for 30 pills. So you can pay cash. You can talk to the pharmacist. We had a case recently where someone needed a steroidal cream. On Medicare, it was $155. We went in and said, GoodRx. Could you look it up? And it was what, like $35, $40? Okay. So it's oftentimes, if you go to the drugstore with your drug card, can I get this cheaper with GoodRx or something like that? And oftentimes you can. Okay? When you're looking at drug plans, here's a mistake a lot of people make. Let's say you're signing up for a drug plan, and the way the Medicare Plan Finder works is it gives you the total cost of the drug. And some people will just say, oh, I want to go to Paoli Pharmacy. Okay, and that's the only pharmacy we put in there. Well, the drugs may be $1,000 to Paoli Pharmacy. This person was 88 years old and had a lot of drugs. I said, well, what if you went to CVS? So I put in CVS. The price was reduced to about $88 because it's a preferred pharmacy. There are out-of-network pharmacies for plans, there are in-network pharmacies for plans, and there are preferred pharmacies. You can go to an in-network pharmacy, but oftentimes it's a lot cheaper to go to a preferred pharmacy.
When you say you put in for the medication and it was cheaper through whatever organization or pharmacy that you were talking about, forgot it.
That's okay.
Sorry.
Let me just kind of show you what I mean here.
I think the bottom line is, at the point you go into Medicare, you feel like you want your life to be simple.
Mhm.
And what the reality is, it becomes like shopping for the best price on a
Just
TV
pay
or
attention.
washing machine or whatever.
These are available, most doctor's offices have these sitting in the lobby. I just grab a few, I am not associated with GoodRx at all.
Mhm.
I just want, you can save a lot of money by going to GoodRx.
Well, what is GoodRx?
GoodRx is just, you go to the pharmacist, you don't really show them this card or give it to them. You say, could you look up the cost of that drug on your computer, goodrx.com. And oftentimes the drug will be a lot cheaper than your Medicare plan. If you want- if you
I'm
want-
familiar.
Okay, you're familiar with it? Sir, do you like one? Thank you. So it's, there are other plans out there too. I mean, that just happens to be probably the one that's on TV the most and the one that's most,
Question from the chat. We were looking at the two higher WellCare plans for PDP to understand difference in pricing. Saw that the lower cost plan benefit document had 80 pages of medicines while the higher plan had 90 pages. What is the best way to look and understand the difference without having to compare these close 100 pages?
Okay, basically you're going to enter your drugs that you're taking into the Medicare Plan Finder on Medicare.gov. Do not go to Medicare.com. It's a trap. Medicare.gov. And what you will do is put your drugs in there, and it will tell you that your drugs are covered by a plan. Okay? So you're only going to be able to do with the drugs you're taking anyway. So you don't have to go to thousands. Most of these formularies, by the way, are between 27,000 and 33,000 drugs. Okay? So it's not, and every plan has to cover at least one drug for a treatment condition. Okay? Does that mean that you're going to get the branded name of a drug on this plan? You may be able to get it on that plan, but that drug is covered by the generic here. Okay? So not every drug is covered by Medicare either. Okay? Only those that are medically necessary. We get people that come in, particularly people that have been to Europe for a long time, and they get drugs over there on prescriptions that you can't get here. So I don't know if that answered their question, but generally speaking too, if you're on Medicare and you get a drug on your Medicare plan, not on GoodRx, but on your Medicare plan, it automatically populates that into the Medicare.gov plan finder. Now, if you're taking a drug that you can get cheaper with GoodRx, all right, or you're, shall we say, buying it from Canada, it's not going to appear there because you didn't buy it through Medicare. So when you do the comparison the following year, we get people that come, you got to make sure that the right amount of drugs are on there. You got to add things or take things off. So there are, this GoodRx falls into the pharmaceutical assistance program, and mail order used to be a lot less expensive, and I'm not seeing that to be the case anymore. Pam has a theory on it that if you ever go to a drugstore, the pharmacy's all the way in the back, and they always tell you to be 20 minutes. What are you doing there in 20 minutes? You're buying something else. Okay. One of the things that we get involved with that a broker or an agent would not necessarily care about is we help people getting help with their Part B premiums, Medicare deductibles, prescription drugs, which we've already talked about through LIS and PACENET. The income limit is $41,500 for a couple for PACENET, and there is no asset limit for PACENET or PACE. So in other words, you can have a couple $100,000 in the bank. It doesn't matter. You can't do that with LIS. Okay. Basically, just what I said. The PACENET does not look at your assets. They look back 1 year at your income. Okay. So, we do one-on-one counseling at multiple locations. In Phoenixville, are you all from the Phoenixville area? You know, the Phoenixville Senior Center, Carrie Foreman over there is a Medicare counselor with us. And we're talking about getting a venue here for evening counseling. One of the problems with only day counseling, and the daycare center, the senior center is shut down by 3 in the afternoon. People that work can't get there. So we come back, the road back. I just want to explain one thing. Original Medicare, A is hospital, B is medical. There are policies, Medigap policies A through N. We can help you navigate that if you like, what you get, what you don't get. There was retiree coverage. I had a beneficiary last week who actually works for the VA. She's being told she needs, the VA suggests you get Medicare Part A and B, but doesn't demand it. Okay? You can have only VA coverage, okay? But if you decide down the line that you want Medicare Part B, you will have to pay the penalty. Okay? And prescription drug benefits, okay, because original Medicare does not offer prescription drugs. That was a law. Okay? Prescription drugs aren't in that law. Okay? So that's a plan that you can change during open enrollment. Medicare Advantage is the privatization of Medicare. They're extremely profitable, but they are network driven. You have to see the doctors, the specialists that are in that network. Mostly of the time, there's no monthly premiums for those. Okay, but you have to be careful. I talked to a guy the other day. He didn't look at his Medicare Advantage plan since 2000. That's the last time I talked to him. He calls me up and he says, "They're not covering anything." So I looked at his plan. His plan went from not having a deductible for medical to having a $1,000 deductible. So the first $1,000 of his medical coverage was coming out of his pocket because he didn't look at his plans. Okay? Complacency is what insurance companies love.
Question from chat. Can you discuss the difference between Medigap Supplemental Plan G versus F? Can you confirm that the difference in benefits is only the $240 deductible? All other benefits between both plans are the same?
All other benefits between those two plans are the same. Plan G has been discontinued for, you cannot buy it after a certain date. I think it's
Plan F.
Plan F, I'm sorry, you can't buy it anymore if you're turning 65. If you're, let's say you're 72, or you're 73, you're working, and you decide you can buy a Plan F, okay? It was a cutoff date by birthday. I forget what that date is, right off the top of my head. Okay? So, but most people who are, let's say, under 70 cannot buy a Plan F at this point. But you're correct. The only difference is that the Part B deductible is not paid. And the reason the government did that is that people who don't pay anything for their medical coverage, okay, which if Part B deductible is being paid, would be the case, tend to use the system more often. So it was a way the government to cut costs. Okay. Starting on May 12th, that's a year old now, they're no longer paying for the over-the-counter COVID-19 tests. The vaccines, no matter what update you get, is covered under Part B. And Moderna and Pfizer are FDA approved, and Novavax is available for an emergency use authorization. And Medicare will not release your personal health information without your approval. If you have somebody that you want to have access to your information, you have to fill out that form. In other words, if you want a child or an adult child to have access, you can do that, or a guardian that you appoint. Medicare abuse is really rampant. Okay? A lot of it occurs through durable medical equipment, you know, scooters and that type of thing. But a lot of unscrupulous Medicare plans push doctors to bill for things that didn't happen. And I haven't seen any numbers in a few years, but it's close to $100 billion a year. So we ask people to check your documentation that you get every month or every quarter, which is your summary notice, to make sure that the procedures and the visits that you actually used are what's on there. And here's where some people get in trouble. You get turned down for something. You have a right of appeal, okay? But the right of appeal has so many days attached to it, 30 or 60 days. If you don't do anything in that period of time, okay, and the right of appeal is usually written right into the form that turned it down, okay? So all you gotta do is say, no, 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 sign it, send it back. If you don't do that within the prescribed period of time, your right to appeal expires, okay? If you are notice, if you get it that you have been denied, you'll be provided with instructions. I've looked at it, and I understand it, so we can help you with appeals. You have the right to complain about the quality of your care. This doesn't happen a whole lot, okay? I'm not going to spend any time on this slide. Okay, and then there are volunteer opportunities for people that want to get involved with the Department of Aging and various services. Any final questions?
I'm guessing with, does any of this take it out of your Social Security? Or-
If you're collecting Social Security, okay, and you turn 65, you will be automatically enrolled in Medicare Part A and B,
Okay.
okay? Now, if you're still working and you don't want Medicare Part B, you have to check a box off on the back and send them the card back, okay? Then they will send you a new card with Part A only, okay? Some people don't want that part. It's dangerous to have Part B if you're still working. Let me explain why. Earlier I made a statement that the Part B effective date triggers things. One thing it triggers is when you turn 65, you have 3 months, okay, to sign up for Part A and B, or just, okay, without a penalty. So now you're working, and this has happened. I've seen this happen several times in the last few years. You're still working, you sign up for Part A and B, okay? You're paying the Part B premium, okay? 3 years down the road, you decide to retire and you go to sign up for a supplement. The answer is nope. You had a window to sign up for a supplement there when your Part B effective date became valid, okay? Now, you have to go through medical underwriting. So, if you're still working, do not sign up for Part B if they send you a card. If you are on disability, or if you're already receiving Social Security, they will automatically sign you up for Part B when you're 65. And if you don't want it, send that thing back. I've had a couple of cases where people didn't do it. They worked till they were 70, 72, and then they decided, I want to get a supplement. Yeah, you can get one, but you have to go through medical underwriting, because starting that effective date of Part B, you had 6 months to sign up for a supplement. You didn't do it. Okay? The other thing I'd like to say is sometimes employers, when the retirement time comes, they might lay somebody off. and they say, we'll cover your benefits for a year, we'll pay for it. What they did is they put them on COBRA. And COBRA is not considered creditable coverage. So you're now a year down the road, and you say, well, I had creditable coverage, I had COBRA. No, you didn't. You pay a Part B penalty, and you have to now go through medical underwriting to get the whole thing about Medicare is stay in front of it, don't get behind it, okay? We help people who want to stay out of that trouble.
What are the advantages of Medigap?
A Medigap is basically you go to any doctor that takes Medicare, that takes Medicare. You don't have to be in network, all right? There is an MOOP, max amount of pocket, for Advantage plans. Pretty much as I said earlier, I've known people that have hip replacements and all kinds of things. You ask them, what was your total cost? Well, I had a TV in my room at the hospital, it cost me $7 a day. You know, Medicare doesn't cover that kind of thing, so you might get hit with a little bit. I just went through 45 radiation treatments, 2 minor surgeries, and my bill was $0.
And how much is the monthly payment for Medigap?
It depends how old you are, because it goes up every year. Because all the plans except 1 or 2 are age attained, and the ones that are not really are. So basically, you know, you're looking at somebody who's 65, female, a plan N would run you about $96 a month. A plan N for a male would be about maybe $20, $30 more than that. Men are more expensive to insure than women. Don't ask me why.
So the other thing about, from my perspective, for Medigaps is the fact that it's not an annual contract, okay? The terms and the conditions are, when you sign up, they're there for the rest of your life, and you cannot be kicked out if you become a high user. The only way you lose your coverage is if you fail to pay your premiums. And you can go, if you travel a lot in the United States, you have family in Virginia or Texas or wherever, you don't have to worry about networks, et cetera. You'd be able to cover your medical expenses with your Medigap.
It gets a little trickier if you go to Florida for the winter with a Medicare Advantage plan. Now, let's put it this way. The Medicare, the Blue Cross Blue Shield Keystone plans, they're basically in almost every state. But when you go down there, you have to find a doctor, you have to do some transfer and everything else like that. They do monitor where you go to the doctor. So if you're down there and they can see you've been to the doctor 7 months down there, that means you're not living here anymore. So they'll catch you.
So Medigap is more comprehensive, but more expensive?
Medicare has a monthly premium to it. I can't say it has better coverage, okay, medically, but with, I had a guy in Phoenixville here a couple of years ago. He hurt his shoulder. He wanted to go to the Rothman Institute to get it operated on. Because the Medicare Advantage plans are not accepted at Rothman Institute. So historically, there's been some question about whether or not you get the same level of medical treatment with a Medicare Advantage plan as you do with a supplement. Having said that, okay, let's say you move to Pittsburgh. Well, UPMC is on every street corner out there. I mean, I'm amazed at how many buildings I saw with UPMC on the lights outside. Almost every doctor is in network out there. Okay? And the costs are lower. I mentioned Punxsutawney. You know, how many doctors can afford to be out of network? There's only one hospital in that part of the county. You know, Philadelphia is a high-cost market. Chester County is a high-cost market. So is Lancaster County. It doesn't help you to move 20 miles. And because of that, pay-as-you-go can get very expensive with Medicare Advantage plans. The Kaiser Family Foundation put out a thing, no, it was the Office of Congressional Oversight, okay, put out a paper, I think about a year ago, that a lot of people were dropping their Medicare Advantage plans in the last year of life. Now, what does that mean? The last year of life means you're going to die. Okay? But they wanted to see the doctors they wanted to see and the coverages they want. Okay? So they were willing to pay the 20% of medical costs. Okay? The other thing about original Medicare and supplement, let's say you go to a doctor and you're getting a physical. Well, the doctor bills Medicare $250 for that, or $300. Medicare says, there's a Medicare-approved amount for that physical, that code. Okay? And that Medicare-approved amount is $150, and the doctor must accept that. So 20% of that, okay, is $30. It's not 20% of the $250. The doctor cannot, you cannot pay more. In some states, you can pay more, but Pennsylvania is not one. In Pennsylvania, it's illegal to charge more than the Medicare-approved amount.
We're closing in 8 minutes. I have 2 questions on chat and then we'll need
Okay.
to stop. You may have just answered this one. If you have original Medicare with supplemental, do you need to call your doctors and confirm that they accept assignment?
No, if you have original Medicare and supplement, no.
Yes.
Most, I would say 95% of doctors accept Medicare unquestionably. Which two don't? These boutique doctors that you pay them a couple $1,000s a year and you can see them anytime you want, but they don't take any insurance. And pediatricians. Mostly every other doctor accepts original Medicare and a supplement. Understand, a supplement, if you, Medicare pays, the supplement must pay. They don't have an option. Okay? The supplement means if Medicare is paying, the supplement must. You get a supplement card, you never need it again. Okay? Once you tell them I have a supplement, they know not to bill you to bill the supplement, and you never use the card again. I'm sorry.
And last question, under Part A for a hospitalization, the benefit mentions 60 lifetime reserve days. What are these days and how are they used?
Okay. This used to be called a spell of illness, and what that means under Part A is if you go into the hospital on January 1st, okay, you're discharged 4 days later, but you go back in, even for a separate issue on February 1st, you do not pay the deductible twice. Nor would your supplement pay the deductible twice. You can go as many times as you want during that 60-day window. Okay? The 61st day, it starts all over again.
Okay. Very good. Thanks so much.
Okay, I hope everybody learned something, or I didn't see anybody fall asleep except you.
Appreciate it. Thanks for coming. Thanks for those on Zoom as well.
Thank you.
Thank you all the people on Zoom.